Hi, my name is Linda Vang, and I chose to do my project on social determinants of health. I'll be focusing on social determinants that affect ocular health, specifically in rural communities. I chose this topic for many reasons. I love public health because it intersects with different disciplines, so I knew I wanted a project that explored this field. It reminds me that health goes beyond the walls of a clinic, and much bigger forces are always in play. Not only that, but social determinants of health and public health in general are incredibly important to our careers as future healthcare providers. Growing up in a small town right outside of Fresno exposed me to the health disparities of a rural community. It is quite different from urban communities like Berkeley, so I want to shed some light on what exactly that means. Generally speaking, social determinants of health are the conditions in the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. This specific definition is from the CDC. There are many explanations and models of social determinants, including this one here. Essentially, everything and anything about you and your life has some effect on your health. Things like your age, lifestyle, education level, work environment, and housing situation all play a part in how healthy or unhealthy you are. Let's now focus on how social determinants affect ocular health in international rural communities. A study in Nigeria reported the social determinants that increased use of eye care services in rural adult populations. Some key findings I found interesting include the following. People who were blind were 3 times more likely to seek eye care, along with those older than 69 years old, live close to facilities, and have comorbidities. In Spain, this particular study confirmed that travel distance, personal beliefs, and cost were social determinants in unresolved eyesight problems. They reported that the rural population's visual health was more negatively influenced by social and economic factors. Let's head to the United States and take a look at the social determinants that affect ocular health in our rural communities. This study took place in Vermont and New Hampshire, in which a vision screening program was implemented in rural communities. The findings presented the average travel distance to screening appointments and the average time for patients' last effort to seek eye care. These are unique barriers rural populations face that affect their ocular health. Similarly, in Georgia and South Carolina, the barriers to access of eye care include distance, costs to travel, and difficulty finding specialty care. The population sampled here was rural and highly rural veterans who live in medically underserved areas. For my research, there is no obvious controversies regarding current data. It is clear that people who live in rural communities are especially burdened by travel costs and distance to eye care. Their ocular health is also more susceptible to the negative effects of social determinants. In my opinion, the real problem is the lack of research available and low awareness of rural community health and ocular health within the United States. If we can learn more about these communities and the problems they face, we can learn how to better help them. As a future healthcare provider, you should definitely be concerned. Rural communities matter and ocular health matters. If it has anything to do with health, it matters and will definitely impact the way we practice and navigate the world, now and for the rest of our lives. This is true for all healthcare professions and critical for an integrated, patient-centered healthcare system in the near future. As current students and future optometrists, we have a social responsibility to leverage change and be an informed advocate for others who need better representation and access to eye care. Not only that, but learning more about these public health issues will allow us to be more versatile in the way we think and solve problems currently and in the future. On that note, I would like to leave you with this from the optometric oath. I will strive continuously to broaden my knowledge and skills so that my patients may benefit from all new and efficacious means to enhance the care of human vision. I will do my utmost to serve my community, my country, and humankind as a citizen as well as an optometrist.